the way every day goes. Every time we've no control. If the sky is big and wide, if the ground is black and yellow, it's the same way you showed me.
Good morning, YouTube family, and welcome back to 7 Days of Vlogmas with Nurse Ashley. And today, don't mind how greasy I look, but today we're going to be doing a day in the life of a public health nurse. I got a lot of questions on what is a public health nurse? What do you do? What does a typical day look like for you? So today we're going to dive right in. I'm gonna be honest with y'all that I work for local government and they have really strict social media policies. So I'm gonna show you all that I can, but I'm gonna keep it cute. So keep that in mind. But y'all gonna get a good taste of what I do every day. Second is I don't know what second is. But anyway, let me show y'all what the schedule is. And hopefully, y'all, for the girls that really just feel like bedside nursing, nursing home, direct patient management isn't your jive. Hopefully, this video helps to give you some more ideas and inspire you, because I know when I was on my journey and I'm still on my journey, I love to look at YouTube videos of day in the lives of certain nurse specialties to just see what's out there. So let's go. So first, I'm going to look at my schedule for today and see what's on the schedule and go over that with y'all. Got my work phone here. Like I said, I'm going to keep it very cute with what I show you guys, because this is my livelihood and I love YouTube. I love my YouTube family, but I got to pay my bills and stuff, so I can't risk it. So let's see. So this morning we have a caregiver social group. So that's something that me and another coworker we're working on, and basically giving caregivers, parents, especially parents in a postpartum period, a time to connect with others in a community at a library. Bring your kids. We bring light refreshments. We have activities for the kids, and it's just really a community connection event, a low pressure, a safe space for us just to talk, ask questions, and I love those groups. So that's an example of a community outreach initiative that I work on. During that same time, today is meeting heavy. During that same time, we have a statewide public nurse health network meeting. So all the nurses that are public health nurses in the state are invited to this meeting. And we just kind of come together, we connect, we talk about issues we're facing, we talk to experts, get tips, advice, see what other public health departments are working on, things like that. But I'm going to miss that meeting because of the parent social group. But for that meeting, I had put together a slide deck and talking points to bring to the group, because there's a nurses day at the Capitol where nurses go to talk to legislators about public health issues that are impacting the nursing practice. And me and a coworker, we started a nurse advocacy group, a public health nurse advocacy group, and we really want to just start using our voices to uplift and impact policies, different things like that. So I can't do that, but my coworker, she's going to present the slide deck and talking points. And then this afternoon, we have a meeting with a wellness center in our area. So this is a great example of community partnership, which is another big part of my job, and getting out in the community and collaborating and just figuring out unique ways to meet the needs of the community members. And again, my patient, if you want to put it this way, my patient isn't an individual, it's the community. So I hope that kind of helps clear up like why my schedule seems like all over the place, but I love it. I thrive in environments where every day isn't the same, but it's like community work. And then lastly, I have a training webinar, which is based on culturally appropriate screening for perinatal mental health and substance use disorders, which sounds really good. So that's my day. And in between that, we might have clinic appointments. I'm just talking in general. We might have clinic appointments where people are coming in to get vaccines, or we might be managing someone that is on LTBI, which is latent tuberculosis. that was diagnosed with latent tuberculosis, and that disease is reportable in my state. And another part of my job as a public health nurse, and I guess I can go into detail about this later, but we might have walk-in appointments where our scope is narrowed in on the individual for an appointment. So like a vaccine appointment, a person might be coming in for latent tuberculosis medication management, which I might go into later. But it's already 7:12, so let me hurry up. Another thing about my job, I work business hours Monday through Friday. I'm off most federal holidays. And this, you guys can see, but this is what I'm wearing, and I love to see in the day in the life what people wear to work. So that's my job, and it just depends where you work. We can definitely dress business casual, and I'm wearing these cargo jeans that I got from Old Navy, and I'm gonna wear these boots. So this is my outfit today. So very casual. I'm able to dress very casual to work business casual, like, but it's just casual. I do that 3 more times again. I testify for you. I'm so that like you, that bitch I do it. Oh, I won't cry, you skinny. I'm not. Long if you joking, now here for me. I ain't got it. I've been skinny, do it. I joke bodies. Long as you dreaming about me, ain't no problem. I don't got nobody just with you right now. But the truth, I look better under you. I can't lose when I'm with you. How can us lose and miss the moment? You just too important. Nobody like you do. I can't lose when I'm with you. I can't just lose and miss the moment. You just too important. Nobody like you do. You know. In the top chat right with you, I feel like Scarface. The party bitch with the bob, I'll be your main one. Let's take this argument back up to my place. Sex from argue, I'm not violent, I'm your day one. We had shit, yeah. It was magic, yeah. Smash and grab shit, yeah. Nasty habits take a hold when you're not here. Ain't a home when you're not here. Find the home when you're not here. I'm saying, I can't lose. Hey y'all, I just got off of work and I did not pick up the camera again after work. It was just a very crazy day, and I was feeling like, dang, I didn't pick up the camera again. Like, this vlog is a bust and I'm gonna have to redo it. But no, I think I'm gonna include this because in public health, like, our job is to respond to the needs of the community. So if there's a pressing need, even though we have something planned, we got to address that need because we're in public health, right? So I'm going to include this clip and just the diversity of a nurse, a public health nurse generalist job. At other health departments, if you work at a bigger health department, like our city's health department is bigger, and you can work in particular departments. So some nurses might work in an immunization clinic, some nurses might work at the STI clinic, and you're like, I don't want to say silos, but that's the department you work in. So it's more routine, it's more like, I know what to expect, it's the same thing every day. Not the same thing every day, because you can get variety in that as well, but it's kind of like, that's my specialty. Versus a generalist, especially if you're working at a small health department, like, you help out with so many different things, and today is just a result of that. So in the morning, we said we had a meeting or a parent social group, which went well. Only 2 families showed up, but that's fine. I know the families that did show up, we did make an impact, and we were able to make a difference with those families, so that was good. So yeah, only 2 families showed up, 3 kiddos in total. I can't show you any clips for that because of HIPAA. Then in between that, I went to Trader Joe's, I got lunch, and then I ate really quick for like 20 minutes, and then we had another meeting with a community partner that I told y'all about, which went really well, but it ran over. And during that meeting, which was good for me because my nurse supervisor were there, and it just showed me how to screen a community partner to partner with them, because at the health department you're representing the local government at the end of the day, and you don't want to like partner with someone or advertise someone that isn't following like evidence-based practice. Like we can't like partner or support or advertise like a particular faith, because there's all people practice, and you're free to practice whatever religion you want to. Like there's a lot of different things that you just have to be careful with. So we kind of like screened them for that. We asked them, okay, well, how would we make a good partner? And they were like advertisement, you know, helping us with like a lactation type of program, because they don't have that right now. And then we offer to them, well, to be a good partner for us, we're looking for maybe like just a way for us to connect with more prenatal parents that come to your organization, or more family, like different things like that. So it was a really good conversation. It went really, really well. Then I got back from that and I was just mentally exhausted. Like there was some personal stuff going on that, thank God, turned out okay. So that was great. Another part of my job is communicable disease investigation. So certain diseases within a state is reportable to the state, and the state collects that data to look at, okay, where's hot spots, what can we do to target prevention, what are some things that we're missing. Like this was big during, you saw it really big during COVID. And then the state health departments, the local health department reports these reportable diseases and follow-ups to the state health departments, and then the state health department, depending on the disease, reports it to CDC, which is like our national health department, if you want to look at it like that. So a suspected GI outbreak at a long-term care facility was reported today, so I had to take that report. Okay, sorry y'all, it was a police officer that was coming. What was I saying? So 5 or more individuals presenting with GI symptoms, so diarrhea, vomiting, nausea, abdominal pain, any of those type of symptoms, 5 or more, they're required to report it to their local health department. So there was less than 5. I won't give you the exact number because of HIPAA, but there was less than 5, and so she reported it, just being nice, which I really do appreciate us having a heads up, because if there's a high influx of patients or anything, it's just good us having a heads up going into the weekend and such. So again, just like being able to respond, and that's pretty routine that a call like that would come in, which is fine. But again, like your day is based on the needs of the community, and no day ever looks the same, which I really do appreciate, which is nice. So we're gonna try this bad boy again tomorrow with me vlogging my day. So we'll see. We'll see.